Welcome, everyone. And before we start the workshop, I would like to introduce today's panelists. So I will start with Dr. Beth Dolan, who is the Interim Dean of College of Health, Professor of English, and Professor of Health Medicine and Society. Before joining Lehigh, she was the Senior Fellow in Literature and Medicine in the University of North Carolina, Chapel Hill School of Medicine. Again, Dr. Chris Daly is the Chair of the Department of Community and Population Health and Professor of Medical Anthropology in the College of Health. Dr. Daly came to Lehigh from the Department of Family Medicine and Community Health at the University of Kansas School of Medicine. Dr. Anand Jagota is the Associate Dean for Research in College of Health and Professor and Founding Chair of Bioengineering, as well as Professor of Chemical and Biomolecular Engineering in the College of Engineering. Before joining the Lehigh faculty, Dr. Jagota was a research scientist for the DuPont Company. Dr. Michael Guzmano is Associate Dean for Academic Programs and the Professor of Health Policy in the College of Health, as well as is Research Scholar at the Hastings Center. He came to Lehigh from the Rutgers University School of Public Health. We are also lucky to have two current College of Health students available for the questions after the presentations. Mia Zabello is a Community and Global Health major in the College of Health at Lehigh University. She plans to attend medical school after she graduates with her BA in 2024. Maddie Shot is earning her BS in Population Health after graduating in 2024. She is interested in pursuing a career in epidemiology or healthcare law. I would like to request Beth to take over and take this workshop forward.
Thank you so much, Shashir, and welcome everybody from Pennsylvania, where we're having a beautiful sunny morning. I hope you all have had a wonderful day. I know you're preparing probably for your evening meals. We're really honored that you've chosen to spend time with us today to engage with the webinar. And we hope, I'll just echo what Shashir said, we're hoping that this is the first interaction in a long and productive relationship. So to that end, we invite you to reach out to any of the panelists by email or through Shashir at any point after the presentation. So I want to give you a quick overview of what we're planning for you today. I'm going to present first, and I'm offering a high-level overview of growth in the healthcare employment sector, as well as some trends that the pandemic is driving. Dr. Daly will then discuss career opportunities in clinical health. Dr. Jagota will turn to career opportunities in health technology, and Dr. Guzmano will share information about career opportunities in public health, health policy, and global health. So we're going to be, throwing a lot of information at you, but we intend to leave 15 to 20 minutes at the end to address your questions. And at that point, you can also pose questions to our students who have joined us. So they'll introduce themselves a little bit at the end, but they're here to talk if you want to talk about student experience. We invite you to enter your questions using the Q&A function at any point during the presentation. We won't get to them to the end, but feel free to record them while they occur to you. Okay, great. So slide. And new slide, please. So as you probably know, the healthcare sector is really booming in the United States, creating new jobs every day. Currently, there are job opportunities in nearly 1 million different companies, nonprofit organizations, and government entities. And between 2019 and 2029, job growth is predicted to grow 15%, adding 2.4 million new jobs, or about 250,000 jobs per year, new jobs per year. Next slide, please. So in India, the picture is much the same, perhaps with even more rapid growth. So there's rapid revenue growth predicted in the healthcare sector, as well as rapid growth in the labor market. So Business Standard predicts that between 2017 and 2022, 2.7 million new employment opportunities, or more than 500,000 jobs per year, will be added. Next slide, please. So what's the nature of all this growth? I mean, that's a complicated question, obviously, that we couldn't answer fully today, but I thought I would dip into a report that Deloitte, the consulting firm, has published on growth trends in healthcare following COVID. And they identify four trends in the healthcare sector driven by the pandemic. And those, as you can see on the slide, are digital transformation, really focusing on four technologies: cloud computing, AI, digital monitoring, and virtual care delivery. Second, innovation in care models. They see, the innovation increasing to raise affordability, access, quality, and efficiency. They've also noted that our awareness of the effect of social inequities has really risen, and therefore there will be opportunities around addressing upstream health issues. And we've learned that collaboration across sectors works. And so there's a sort of policy implication there in terms of going forward, how can we build on what we've learned through this experience? So I'll dive into each of these four just really quickly, a little bit more depth to give you a sense of the job opportunities that are related to these trends. So first of all, COVID-19 jump-started digital transformation in healthcare, most obviously telehealth or virtual care. And further innovation in this area promises to expand access to healthcare services and to create a more effective care experience if we pay attention to the people part of this. So Deloitte explains that healthcare organizations are transitioning to health IT systems powered by cloud and data and analytics tools to enable real-time smart digital health. They're using interoperable data and platforms supported by deep learning capabilities, always on biosensors and behavioral research to shape consumer beliefs and actions. They're also applying virtual care, AI, and other technologies to personalize medicine, enable real-time care interventions, and provide behavioral nudges. So one of the challenges that Deloitte identifies is the creation of interoperable data. So since the implementation of electronic medical records, and the growth of big data entities, really mega data entities such as Google, Microsoft, and Amazon, we've accrued mountains of data about people's everyday lives and health, sort of behaviors. As Deloitte notes, to use all this data effectively, we need to refine data interoperability so that healthcare providers, insurance, and other stakeholders can actually make positive changes. So that implies lots of jobs in, biostatistics, data analytics, population health, et cetera. You can read the potential, just a selection of jobs on the right-hand column. Next slide, please. So second trend, innovation in care models. So COVID-19 highlighted long-standing challenges in healthcare affordability, access, quality, and efficiency. And these are problems that Deloitte feels can be addressed with care model innovation. And this innovation, of course, it's related to the digital transformation that I just described. So Deloitte observes that more than ever, consumers will expect care to be available when and how it's most convenient and safe for them. And this includes virtual care, at-home prescription delivery, remote monitoring, digital diagnostics and decision support, and self-service applications for education, behavior modification, and social support. Next slide, please. So globally, COVID-19 threw into sharp relief the ways in which systemic social disparities lead to health inequities. And to address this issue, we need to focus on the 6 upstream factors listed on the slide here. Deloitte predicts an increase in the need for professionals in the careers listed to the right to help address these issues. Next slide, please. So as I mentioned, COVID-19 has led to unprecedented cross-sector collaboration. So for example, the vaccine was developed in record time, in part due to collaboration across academia, industry, and government. So this kind of partnering needs to be studied and then implemented for other global health challenges. And that sort of both the health policy piece and the implementation piece imply job opportunities in the future. So that's a very high-level overview of changes in the healthcare sector. And I'd like to now turn it over to my colleague, Dr. Christine Daly.
Thanks, Dr. Dolan. Welcome, everybody. Thank you so much for joining us this morning. And what I'm going to be talking to you about is careers in clinical health. Obviously, when people think about the healthcare industry, they think very much about these clinical jobs, first and foremost, though they are by no means the only positions out there. I'm going to talk through some of the more obvious ones first, things like physicians, nurses, dentists, and pharmacists. And then I'll go into some of the others. So if you look at the slide here, you'll see, within the physician realm, we have primary care, specialty care, surgeons. We also have physician assistants, which a lot of people forget about. A physician assistant does a lot of the same kinds of things that primarily primary care physicians do. They require a little bit of a different training, but it's another option for people to go into. I do know that in India, many people get an undergraduate degree in medicine. In the United States, it is a graduate degree, and I'll talk a little bit about the requirements to go in there shortly. But physician specialties are numerous and wide-ranging, and I'm happy to talk to any of you about them if you have questions at any point. Nurses, we also have a lot of different careers within nursing. People think of just the standard sort of nursing career, but we also have a lot of upper level nurses. And so there's a lot of graduate nursing degree programs out there that our undergrads prepare for. Things like nurse practitioners who do a lot of different things, but are very, very similar to physicians in a lot of ways. Nurse midwives, who of course help in the OBGYN realm. Nurse anesthetists, who are rapidly taking over a lot of the anesthesiology out there. Psychiatric nurses, who work a lot on the ground. Psychiatric nurses are a huge asset to so many different communities because they have that sort of dual training in psychology, psychiatry, and nursing. Dentists, of course, we all need dentists. We have medical dentists and surgical dentists. And again, you have the dental assistant, which is another opportunity for students. Within the pharmacy realm, you have your pharmacist, which everybody knows about. You also have pharmacy technicians, and then you have pharmaceutical researchers. And pharmaceutical research has become a huge career opportunity across so many different sectors. And I know Dr. Jagota will also be talking about some of the research that's available in industry. And I will actually talk a little bit more about that as well. Slide, please. So I mentioned that in the United States, medical school is a graduate degree. So to get into medical school, there's a whole bunch of different requirements. And just very briefly, it's a lot of biology, chemistry, physics. Some schools require calculus, other schools will require some behavioral health. If anybody's interested specifically in what the undergraduate requirements are to medical schools, please let me know. I have lots of information on that and can certainly get that to you. But if you take a look at the undergraduate majors that got into medical school, so this is 2020 data from the American Medical Association, you see the vast majority, 58% biological sciences, 10% physical sciences, and so on. Actually, the second highest category is other, which is a bunch of different majors. The work that we do here in Pennsylvania, we work in specialized health sciences, which is only 4% of matriculants to medical school, but it is rapidly growing. As are the social sciences and humanities. You see more and more medical students coming from these other fields of study that are not biological sciences. Medical schools, and I worked at a medical school for 16 years, medical schools really want to see students who stand out. And so they like these different majors. So I would encourage you to talk with any of your students who are interested in going to medical school in the United States to think about some of these other majors. I know the MBBS is a very, very popular degree. And I will say that we do have a lot of MBBS folks coming into our residency programs in the United States, but it can be challenging. And so sometimes people like to take the other route of going to college in the US first and then going to medical school here. So please contact me if you have more questions on that. Next slide, please. Okay, here's some other careers in clinical health that are not always recognized. So just to kind of go through very, very briefly, doctors of chiropractic, and there's other types of what we call complementary medicine, which I don't know how much I like that term, but other types of medicine that are out there. Ayurvedic medicine, which is not on the slide, but another hugely popular field. Those are other types of doctors. Now, we also have people like social workers, psychologists, dietitians, all of these different types of fields. And many of these you can get at the undergraduate level. So you can get undergraduate degrees in psychology, in dietetics, in social work. You can also get graduate degrees in those areas. So, you know, it's a choice for a student as to what level they would like to study to, essentially. Physical therapy, occupational therapy, and speech language pathology all sort of work together and are part of that overall care team. Those do typically require graduate degrees, but again, you can get some really good foundations within the undergraduate degrees, and it doesn't have to be in biology. Finally, the laboratory medicine technologists, those folks can have a variety of different degrees, and they work within the labs. They tend to help out with pathology, with different diagnostics. And so those are also hugely important careers and lots of opportunities. Everything you see on this slide, we always have shortages of. So we need people to go into these fields, and anyone you can encourage to consider some of these other things. Please encourage them to do so. You know, we have too many people who just think of the narrow definition of clinical health as a medical doctor. There are so many other opportunities out there. Next slide, please. I wanted to take a moment to talk about sort of medical research. Medical research really takes the form of drug discovery and clinical trials. There are other types as well, but just to talk a moment about these. So when you're doing drug discovery, you're talking about people who are working in the lab, and they're trying to figure out all of those medicines that are helpful. So obviously all of the people working on the COVID-19 vaccines, but also people working on any other medications. For example, cancer medications are a huge industry. We are always looking for things to treat the variety of different types of cancers out there. So you have this sort of preclinical phase where people are discovering those drugs, figuring them out, moving into animal trials. Then you turn into the clinical phases, and that's where people like medical doctors come in. But not only medical doctors, you still have a lot of people who are medical researchers doing all of those different types of medical research in these phases. And so those are the clinical trials that everybody hears about, and we've been hearing about them so much with the COVID vaccines. So then you start into the clinical phases. That's where you get people who do more social and behavioral research coming in as well. Because of course we need to find out if medications are safe, but then we also need to find out if they can be used in the real world. And that's where a lot of us social behavioral researchers come in to the later stage clinical trials. And then finally, of course, you have drug approval. And after that, we call them the phase 4 trials. That's where we really see long-term effects of things. So when a drug is developed and ultimately approved, we still need to know what's going to happen 20 years from now. And there are tons of people working in medical research learning that. And that can be at academic medical centers, and it can be elsewhere. So actually, next slide. We'll show you some of the places who are doing this kind of work. So obviously, academic medical centers, the National Institutes of Health in the United States. But then you have a lot of private foundations. So things like the Gates Foundation or ACER, American Association for Cancer Research, et cetera. You also have industry. The pharmaceutical industry is a huge drug developer and runs tons of these clinical trials. And there are job opportunities just every single day. There are thousands of job opportunities out there in the industry sector, and these are global. These companies are everywhere, and huge, huge opportunities for your students. So I really would encourage you to look within the full realm of clinical health if students have an interest in that area. So thank you. And I believe I'm turning it over to Dr. Anand Jagota, who is going to tell you a little bit about engineering. Thank you.
Thank you very much, Dr. Derry. Yes, I'm going to speak a little bit about health technology, what that means. And I'll start by just listing the degrees that train in health technology. And you'll notice they're the obvious ones, a bunch from engineering and from the sciences. So preeminent is what's the newest discipline in engineering, bioengineering or biomedical engineering, and a new one that's emerging, biocomputational engineering. But they've taken their arising from the more traditional engineering disciplines. And the one thing to know about where health technology is that it's everywhere in engineering. And so when I'm asked the question, what do you do with a degree in engineering? How is it related to health? The answer is a bit complicated because you can look at a list like devices, pharma, materials, prosthetics. But I like to put it in terms of a diagram I'm going to show next, which unpacks this and, at least to me, makes it a little easier to understand the diversity of opportunities that you get through a degree in engineering. So in this chart, I've got bioengineering, biomedical engineering on top. This is the newest health-related discipline within the engineering colleges in most places. And it covers everything, but it's has its arising from the traditional engineering disciplines: mechanical engineering, chemical engineering, electrical and computer engineering, computer science and engineering. We distinguish the two, but not all schools do that. Material science engineering, civil engineering, and industrial systems and engineering. So these are, think of these as the disciplines where you could get a degree, or you can study that within the context of bioengineering. And on the x-axis here, I put down length scales. So down here, at the smallest length scale, we are at the scale of atoms, as shown in this picture here. And as we march up the length scale, we go from atoms to the functional molecules of biology, like DNA, or macromolecules that fold into proteins. Imagine that this is a spike protein interacting with the receptor, which causes COVID, for example. And you run through the length scales to organelles, and all the way to the human scale, and then beyond that to the population scale of the entire Earth. And if we look at it in this way, it's sort of easy to unpack the opportunities that you have. So let's start from the top. So in mechanical engineering, the traditional opportunities are in things like prosthetics. And that's sort of obvious. But new opportunities are developing in single molecule versions of what mechanical engineers do at the large scale. So single molecule spectroscopy. Chemical engineers, they are the ones who actually get large scale vaccine production to work, for example. And so this is the application of the sort of training that might have been useful in a traditional chemical plant, but it applied to production of biological materials, which has their own issues and problems. It's not just a direct application. At the other extreme is the application of chemical engineering principles to biomolecules and how they interact with each other. Electrical and computer engineering, the ones that come to mind right away are the whole human scale MRI, CT scans, but there's a tremendous amount of development and opportunity in point of care diagnostics. This addresses inequity issues, efficiency issues, global health. Computer science, the whole field of bioinformatics, people don't realize how important this was in solving the human genome project, and there are hundreds of other applications. The materials applications are in biomaterials, tissue engineering, and then a couple of others that are not quite as obvious. So civil engineering applies to health in low resource settings, for example, and industrial systems engineers who are trained to optimize engineering operations in factories and plants. Those ideas can be applied to optimizing, those ideas can be used to optimizing the operation of hospitals, for example. So I hope this helps to place the different opportunities within the structure of what are the biological necessities and what are the different disciplines that contribute to it. So this slide wants to keep coming up. So let's look at this slide for a minute. So where do students go after graduation? I picked an example from a recent class at Lehigh, and you'll see that nearly the majority, or a half, go employed. Here means they went into industry. And if you glance down this list of companies, you'll notice some very well-known large companies and a bunch of others that are good companies, not necessarily of the size of Merck and Johnson & Johnson. About a third go on to graduate school, both within biomedical engineering, bioengineering, but also to professional schools, medical school, dental school, and so on. This is not entirely typical, I should say. Depending on the school, you may get a big sliver of going to professional school, bigger than we are seeing here. So with that, I will end my remarks and hand it to, oh, I'm sorry, I forgot to mention this. I wanted to show this as a screenshot from a website of the US Bureau of Labor Statistics. And this is an excellent place to go to get more information. Here I'm put up a page for bioengineers, biomedical engineers, and you can glance at the sort of information this provides: median pay, what entry-level education you need in this profession, how is it growing, and you'll see another example of an application built on this website from Dr. Guzmano. So with that, let me hand it over to Dr. Guzmano.
Thank you, Dr. Jagoda. It's great to be here with everyone. So I get the exciting task of explaining 3 different fields and talking about public health, health policy, and global health. Dean Dolan earlier talked about how COVID has highlighted the importance of health and the health field more generally, and certainly what we've all been experiencing for the past year and a half or so has helped to highlight the importance of public health, health policy, and global health. As a friend of mine said, you can't explain differences in outcomes and differences in response across the globe without looking at health policy. But it's also highlighted the importance and the need for people working within these fields. And what I've known from working in public health and in health policy for over 25 years is that there are extraordinarily exciting opportunities for students. One of the things you like to do as a university professor is to find out where your students go, what they do after they graduate, and my students have gone all over the place in government, in business, into research. And their training has actually been quite varied as well. So if you want to work in public health, really your opportunities are really quite open as an undergraduate. As Dr. Daly mentioned, medical schools are increasingly looking for people from sort of non-traditional backgrounds, social sciences and humanities, but still the majority are in biology and other physical sciences, and certainly, as Dr. Jagoda explained, in bioengineering. It's going to be sort of various fields within engineering as well as the physical sciences. In public health and health policy, global health, students come from all over the place. Everything from business degrees for people who are interested in, say, hospital management and focusing on other organizational jobs and leadership positions, to the humanities. I work at the Hastings Center, which is a center for bioethics, along with my position here at Lehigh. And so I work with a lot of people with training in philosophy and social science. We have 2 PhDs in English. So we really have a variety of different backgrounds focusing on issues of public health and health policy. Language majors are extraordinarily important. People often don't think about that, but if you're doing global work, which I've been doing for the past about 21 years now, you are always desperately looking for people with language skills because it turns out to be rather important when you're working across the globe. Some of these undergraduate degrees can lead directly to jobs without going on to graduate school. There are people who study statistics, economics, a growing number of undergraduates who are getting either BAs or BSs in population health and in community health or public health programs, as we have here at Lehigh, and they can often find employment immediately after graduation. But a lot of them do go on to various graduate degrees, and I'll talk about that in a moment. Next slide, please. Thank you. So where do people go? What fields, what industries do they work in? What sectors? Again, enormously varied. As you heard earlier, there are a lot of people who do go into industry, working in the pharmaceutical industry, medical device manufacturing, in addition to employing biostatisticians and epidemiologists. Increasingly, these industries will employ people in health policy, health economists. If you think about the way these sort of devices are regulated, you not only need people who have the skills to do comparative cost effectiveness analysis, for example, which is used by many countries in evaluating these devices, but people who understand regulation, who have backgrounds in public administration, or as I do in political science, can be quite valuable in these industries. The insurance industry is quite huge, even in countries unlike the US, which primarily have public health insurance and don't rely quite as much on the private health insurance industry, there are huge numbers of job opportunities. I've been doing work in France for a long time, and one of the groups I work with very closely is the largest health insurance organization in France called the CANAM. They employ sociologists, anthropologists, economists, biostatisticians, epidemiologists to really understand what they need to cover and how they ought to develop payment systems for those healthcare services. Clearly, when we think about public health, one of the first things that comes to mind are government opportunities. So people work in ministries of health, departments of health, either at the national, the regional, or the local level. There's the CDC in the US, and there are CDCs all over the world, employing armies of epidemiologists, biostatisticians, and certainly, again, during the pandemic, we got to recognize the importance of epidemiological surveillance and the talent to not only collect, but make sense of data and provide us with projections. I know one of the questions in the chat was about, the potential value of MBAs, and we can talk about that later. But increasingly, we have people who are combining the study of public health, population health, health policy, with the study of business and organization. We're about to launch joint master's degrees with our business school, and there are joint master's degrees with many schools of public health throughout the world, in part because you have students who really want to play leadership roles in hospitals and in health systems, and they want that sensitivity to population health and that understanding of population health combined with the kinds of the training and how to run organizations that you often get from a business school. Our students have often gone on to work in professional associations hired by, the American Medical Association, Academy Health, which is our big association for health services research. And then a field or sort of an area where people can find jobs that are certainly undergraduates rarely think about are actually foundations. As any of you in global health know, if you could go back for a moment, thanks. As many of you know, in global health, it is now dominated by big foundations like Gates and the Clinton Foundation, sort of swamping the WHO in terms of funding. That comes along with lots of job opportunities. Okay, if we could go to the next slide. Thank you. So here's just some specific jobs that people can, pursue within these industries. Obviously, biostatisticians, everything from information specialists to people who are involved in drug and safety evaluation, epidemiologists clearly, but also environmental health experts, working as everything from people working in public health departments to community activists, people working in health policy and outcomes, which is a growing field of research where they both analyze the causes and the consequences of different health policies, people looking at outcomes research to evaluate how interventions are affecting population health. Next slide, please. And I just wanted to mention this resource, which can be quite valuable, I think, to anyone working in your field. This is from the US Department of Labor, and it's a data set called Onnet, and you can find it very easily. It provides a lot of US-centric information in terms of the specifics with regard to salaries and the like, and even to some degree to training. But it provides a very nice overview for almost any occupation you can think of, and you can see you can do a quick search, a keyword search at the top. It's very user-friendly. Here is just a screenshot for epidemiologists, and it will tell you what sorts of work they do, what kinds of training are typically required, whether or not you can get a job in that occupation with an undergraduate degree, or whether it requires further graduate study. But it will also tell you details about what kinds of skills are involved, even what kind of temperament you ought to be having if you want to do that job. And then, of course, what many people are always interested in, well, how much money can I make? And it will provide you with a range of salaries for starting jobs and people with higher level degrees. So it's a really useful tool. Most of the jobs that we have listed here in our slides can be found. And so you can go through sort of links to look in more detail about some of the careers that we've already described. And with that, I'm going to turn it back to Dean Dolan, and I think we're going to go to our Q&A soon.
Excellent. Thank you so much to all my colleagues for those really informative presentations. And I just want to confirm that Shashir will be sharing the recording of this event with everyone a few days after, once we've got it in good shape to share, if you, have some details that you'd like to return to. So there are a lot of good questions in the chat already. And before we get to them, I'd like to have our students, if they don't mind, introduce themselves. And I'd be interested in hearing them just reflect very briefly on what are the factors that are helping you make a decision about where your career might go. And I know it's early days, so both of these students are sophomores in their second year of university. And so of course they are still exploring, but I think it'd be interesting to hear that. So Maddie, would you mind introducing yourself and sharing your thoughts on that?
Yeah, sure. So hi, I'm Maddie Shot. I'm a current sophomore at Lehigh, and so my expected graduation year is 2024. Just some background information, I'm from Connecticut, which is a very small state on the East Coast, and it's about 3.5 hours away. And I am a population health major, as Dean Dolan said before. So some things that have, sorry, there's someone in my hall if you hear that. So some things that have kind of shaped my College of Health experience is I was recently an intern over the summer for a mountaintop project that studied Indigenous studies and also American Indian health and education programs. And so I'm going to be continuing work with that over the semester with the Institute for Indigenous Studies as well. So that's been a really great opportunity for me to kind of branch out in the College of Health and see the different types of internships and opportunities that are available to students. As well, I've taken a lot of data science classes that looks at data statistics and analysis of certain diseases, which I think is really interesting, which has kind of let out a branch because I'm typically a student that is more of the anthropological side of the population health major. So by using data science, this has also allowed me to branch out and incorporate science and math into my major as well, which has kind of led me to want to become an epidemiologist, which is the study of diseases. And so obviously right now, I think we could all relate that that's a very popular topic with the COVID-19 epidemic. So this has really allowed me to see that we can take what we're learning in class and apply it to real life. So that's my introduction.
Thanks so much, Maddie. Mia, would you introduce yourself and reflect on your path?
Sure. Can everybody hear me okay? Okay. So my name is Mia Zabello. I'm from Pennsylvania, about an hour or so from Lehigh's campus. Like Dean Dolan mentioned earlier, I'm a community and global health major, so I'm pursuing a Bachelor of Arts. I'm in my sophomore year at Lehigh, and I hope to go to medical school after graduation. So in my first couple years, I have been completing some of the pre-med requirements. So I've taken now a semester of general chemistry, which I was able to opt out of the first semester of that from my high school credits. I did the International Baccalaureate diploma in high school. So I took a semester of general chemistry. I'm currently in a semester of organic chemistry with lab. I've taken a semester of intro bio with lab. I'm now in my second semester of bio with lab genetics. And I'll continue with those prerequisites as I go along. I actually started off as a population health major pursuing my BS, but I realized that I, unlike Maddie, was really not interested in the data and the statistics and analyzing those. So I did a little bit of soul searching and realized that I was really more interested in the social determinants of health and passionate about disparities in health and inequity and inequality. So that's where my passion and my hope to go into healthcare comes from. I also at home work as an intern in a primary care, so family medicine and pediatrician's office. And that has also sparked my desire to go into primary care myself. I want to specialize in that area of medicine and focus on like a holistic view of health. and looking at social determinants, things like nutrition and mental health that aren't as prevalent when you're looking at receiving medical care from your physician.
Thank you so much, Mia. There's a related question to, I think Mia's path in the Q&A, and we'll start there. And the question is, and I'll shoot this one to Dr. Daly, how do students meet entry requirements from other streams for medical schools?
Sure. So for medical school, there are specific classes that you have to take, but not a specific major. So when you go to college, you have roughly 120 to 140 credits that you need to take. And your major only accounts for maybe 60 or 70 of those credits, often, sometimes a little bit more, but never the full amount of credits. So then you take your pre-meds on top of your major requirements, and that allows you to get everything in. I'll give you an example just from our own college. We have majors in population health and community health. And so you take a certain number of credits in there, but then within that, you also have concentration electives. So what we do is we work with students to make sure that they're getting all of their pre-med requirements and incorporating them into their major and specifically into those concentration credits to also allow them to have the clinical experiences and, the clinical pre-med, the clinical requirements that they need. So you can also pull in, and part of the requirement for medical school is that they like to see students who have had clinical experiences. So we build in an internship, and many colleges do this. We build in an internship that allows students to get out there and get those clinical experiences that they need. So it's actually very easy to have a variety of different majors when you are, going towards medical school, because you have those extra credits to deal with. I just want to add, if you're coming in from another country, they will take a look at your coursework and they will match it up to US medical pre-meds, the requirements, and they will make sure that all of the coursework has been taken as well. So if someone were to come in from India to the United States, they will take a look at those as well and make sure that they match up.
Excellent. So thank you. I'm going to shoot another question to you, Dr. Daly. So it's related. Would a liberal arts degree help in deciding if a medical career is the right path?
Absolutely. What I love about a liberal arts education, and I'm a big proponent of a liberal arts education, what I love about it is that you get experience in a lot of different fields. So you take classes in a wide variety of areas. At most liberal arts institutions, you're going to take some classes in social science, some in the life sciences, some in the humanities, and you'll sort of get a little bit of taste of everything. And what that does is it allows you to say, well, I like this, or no, I really don't. So the liberal arts education allows you to have options and introduces you to many different things. So I think that's one of the best ways to prepare for any clinical training.
Okay, great. So let's take a question for the students. There's one of our participants has asked you guys which other colleges you applied to before you decided on Lehigh, and had you considered other programs elsewhere or at Lehigh?
I can take this one first because I actually really agonized over my college decision for a while, and I was very torn about it. So I was between Lehigh University and the University of Pittsburgh, which would be a state school for me, and it is a public school. And there I probably would have pursued a biological science or chemistry as my major, because I was still hoping to be on the pre-med track. And what it came down to was actually the College of Health. And that was the main reason I decided to come to Lehigh, just because of its uniqueness. And I knew that I wouldn't really be able to get a background like this anywhere else. However, I do think that there are benefits to pursuing a biological science as your major, because you can specialize in population health or public health areas on your own. I don't know if that's helpful to anyone else, but I applied to kind of a wide range and mixture of liberal arts schools, for instance, the University of Richmond, and also public, more urban schools like Northeastern University.
Yeah, I kind of had a similar experience as well. Lehigh had always been one of my top schools, but my guidance counselor always told me to have many options. So as I mentioned before, I'm from Connecticut. So similar to Mia, I also was between, at the end, Lehigh and the University of Connecticut. I probably shouldn't mention this, but top other school was Lafayette, which is our rival. So we just ignore that now. But I would say that the main reason why I decided on Lehigh was similar to Mia, was the College of Health. UConn didn't have a similar program to this whatsoever. And I remember that the driving force for when I ultimately decided to come here was I really wanted to try to pursue the population health major and be part of the inaugural class. I ironically was actually enrolled in the College of Arts and Sciences when I first accepted my admission at Lehigh, but I had been planning to transfer into the College of Health, hopefully my sophomore year, or continue to take classes my freshman year. But I reached out to the dean early on before my freshman year started, and he granted me the ability to transfer into the College of Health, which I'm really grateful for. So I definitely say that was a main motivator. Even though I technically wasn't enrolled in the college, I already had that plan that I was going to transfer in, and luckily I was just able to do it earlier on than you usually are. So I had a very similar experience to Mia as well.
Great, thank you so much. So we're going to switch over to the realm of business quickly with a question for Dr. Guzmano. Can you highlight getting an MBA in terms of the future of healthcare careers? And you talked a little bit about this in your presentation, but wondered if you'd elaborate.
Sure. No, I think it's extraordinarily important. I've been able to, as Dean Dolan mentioned earlier, I came here from Rutgers University, and I was teaching in a master's in public health program, and a lot of master's programs like ours you sort of collaborate with business schools, in part because there are a lot of people who are interested in combining those types of careers. And I think there's a kind of a growth in opportunities. We would immediately think about people who are working in hospitals. So many hospital administrators, there are degrees obviously in hospital and health administration specifically, but many people who want to go on and play leadership roles within the hospital industry have MBAs combined with some sort of background in either public health or population health or a related field. But I think if you're looking at executive positions in almost any industry, pharmaceutical industry, medical device manufacturing, even people who want to go on and work in government, more traditionally, they might receive degrees in public administration, and many still do. But certainly many government agencies around the world are interested, or they're being pushed to think in terms of competition, think in terms of efficiency and value. And I think degrees in business schools, MBAs, and the like are increasingly valued for those kinds of jobs as well.
So thank you, Dr. Guzmano. You really answered another question in that answer, which is what kinds of jobs would a public health graduate get in hospital and health systems? Do you have anything else you'd want to add there?
Yes, I do. I think the really important thing to recognize, and I alluded to this earlier, is that even in healthcare systems, there has been a greater appreciation, even before the pandemic, but I think accelerated by the pandemic, in thinking sometimes what is called upstream. So thinking about the social and economic determinants of health. In other words, we always think about things like food and water and education and how much money you make, and those broad factors as influencing your health status. But increasingly, we recognize it also influences how and how much health care you actually use. Many countries around the world, including the United States, have had financial incentives, for example, for hospitals to reduce hospital readmissions, right? So if someone is being discharged from a hospital, the last thing you want is for them to bounce right back into the hospital within a month or 2 months unnecessarily. And frequently, the reason they do is because we are not attending to their social circumstances. We aren't paying attention to whether or not they have adequate food, adequate housing, adequate care outside the hospital. And so hospitals are now employing many people with that understanding of the social and economic determinants of health.
Thank you so much. So we have a couple more questions related to pre-med, or pre-vet, so pre-health career. So Dr. Daly, one of our participants notes that a student has come up to ask whether or not he can drop his maths in his A levels, and he's in grade 11 and he wants to pursue veterinary medical science. And so what do you recommend to this student, Dr. Daly?
Quick answer, no, don't drop math. The longer answer is veterinary pre-vet requirements are very similar to pre-med requirements. And calculus is one of those for many schools, not every school, but for a lot of them. So we encourage our students to go all the way up through calculus level in college. So college calculus. The other thing is, even for schools that don't require calculus, they do require physics, and a lot of physics programs require calculus. So even if it's not explicitly listed, it is there. So you really need to continue math through all of high school and then take a college level calculus class.
Great. So another pre-med question. So for students who graduate without the required pre-med courses and need to take a bridge year or extra classes before applying to medical school, are there any specific recommendations that you have, Dr. Daly? Can they complete these courses online from abroad or at community colleges, et cetera?
You can complete them anywhere. There are specific post-bac programs that are pre-med programs. They're usually between 1 and 2 years, depending on if you have any of the pre-meds done as an undergrad. But really, one of the things people think is that you must take these classes at your home college. You don't have to. You have to take them. So you can take them anywhere. And many people do take them online through community colleges, through other places, honestly, because it's less expensive. And you can do them on your own time and kind of work it into your schedule. So really the importance is getting those things done, because the true importance is doing well on your MCAT, which is the standardized test you must take to get into medical school. So anywhere you can take the courses that you need to be able to do well on that exam, you're going to be fine.
If I could just add a little bit to that, I know that for some medical schools in the United States, for your important pre-med classes like certain chemistries and physics, they recommend that you take them at a 4-year university instead of a community college. However, it does depend on the school. That being said, I will be looking into some summer classes just because I started off on the BS, so I'm like a little bit behind on my pre-med requirements, but I'm looking to do that at a state school within Pennsylvania so that it's more affordable. So that's an option as well, and you can do that online too.
Thank you so much. That's really helpful. So we have a question here that either Mia or possibly Dr. Daly might be able to answer. What is the minimum score for an IB student to get in? I'm assuming to get into medical school or to have a course count towards a pre-med requirement.
I'm not sure about for medical schools. I know that there actually are some medical schools that don't take IB credit, and I'm sure you could find a list of those online. But I know, at least for me at Lehigh, I only was able to get credit for my HL courses, my higher level IB courses. And for those that I got credit for, it was chemistry, higher level chemistry, and math. So I got 5s on both of those. Granted, my exams were canceled because of COVID, so I was only scored on my internal assessments and other things. But yeah, so I scored a 5 on my chemistry and math out of 7. And I was able to test out of calculus 1 at the college level and out of chemistry 30, which is Lehigh's basic level chemistry.
Yeah, that's exactly right.
Thank you so much. So another question, when is the MCAT taken? Is it after one's undergrad, and is that a precursor to being admitted into med school?
Yeah, so the MCAT is a requirement for getting into medical school. So it's absolutely required. I don't know of any medical schools that don't require it. You can take it as early as the summer after your sophomore year. Most people take it during their junior year. Some people will retake it later. But yeah, the earliest would be summer after sophomore year, but most people it is that junior year. You need to have taken most of the pre-med requirements to be able to take it, because it tests. It's not like the SAT where it's a little more general. It's very specific and does test you on your knowledge of biological science, physical science, chemical sciences, things like that.
Great. So we have two more questions that we'll take before we wrap up here. And one has to do with opportunities in the United States for working. So I'm not sure who might want to take this question, so feel free to hop in. So the participant says, I've been working as a tutor at pharmacy college, and I'm looking for a good opportunity in the health sector. Would this person get opportunities in foreign countries?
I mean, I'll say, you know, working in global health for quite a while, that I think there typically are, and certainly within the U.S., there are typically lots of opportunities. We often talk about within our health, you know, healthcare system alone, that if it weren't for foreign medical students, we wouldn't actually be able to staff many of our hospitals. And I think there's certainly a desire to hire talented people from around the globe. Given COVID restrictions on travel, that's a little more challenging these days, and we always know that visas can be a bit of a challenge in terms of the hiring process and securing visas. But I certainly think in many industries within health, sort of the broad array of industries that we've talked about here today, there are many opportunities for people from other countries, and certainly I know many Americans who have gone abroad in seek of work in Europe and in Asia, really throughout the world.
Can I just chime in actually? So it's easier to get a job if you do some studies, because, you know, it's difficult for an organization to hire you directly, because they don't know, you know, how you will fit in work-wise, and whether you have the necessary qualification. And another thing is that, you know, in US, litigation is also a thing. You know, if you're doing in malpractice insurance, and litigation is also very important for us to consider. And we also think about, you know, we cannot let anyone else touch the patient till the time we are clear that, you know, you have the desired qualification, the desired training to do so. And that's why either you have to complete a licensing process to, you know, work with the patient, or you have to do some sort of education in US, and that helps. And sometimes, you know, when there was a crisis, people were hired from all over the place. You know, there was a time when there was a crisis regarding medical lab technicians, or in fact, radiology technologists, and people were hired from Australia, Europe, and other places also. So it all also depends on what skill set is required and whether you have those skill sets or not. But my recommendation is that go for a program, a better or a more, where you get more exposure, and then it will be easier to make the transition.
I think the licensing issue is a great point, Shashir. Thanks for bringing that up. I have a colleague who's a pediatric surgeon, and he worked in China for many years before he could actually perform surgeries with his Chinese colleagues, because he had to wait until he had the appropriate licensing within the country. The other thing I wanted to mention quickly is there are many global sort of companies. So again, depending on the field you are in, my brother, for example, who works a bit in health IT, he's the North American manager for a Singaporean-based company that was started by a Brit. So they're quite global, and they are continually transferring people around the world.
I would add that on the engineering side as well, the route is the one that Shishir mentioned. You come for education to the US, historically at the graduate level, but now more so at the undergraduate level as well. And then you do OPT practical training, or it goes straight for an H1 if somebody sponsors you.
Thank you. That's really helpful, you guys. So the next question is really about experiences prior to university or to pre-med. So there are two questions related to this here. So one person asked, what kind of internship would be helpful for pre-med or healthcare, you know, curricula? then another person asked, and this has to do with really our situation in the pandemic, what types of online virtual experiences would be valid for secondary students planning to apply to university, but struggling to participate in traditional internships during the continued pandemic? I could start out with one quick comment on this and then invite anybody else to jump in. I think that in terms of the online virtual experiences, when you're applying to university, I would say anything that demonstrates your commitment and passion for what you're applying for is still very valuable. And of course, any kind of experience helps the student, figure out how their interests connect with the real world and the needs in the real world. So I think they're valuable still, even if they're virtual. Anyone else want to comment on that?
I can just comment really quickly. So my internship that I did this summer, they had the option of being in person or virtual. Now I actually was on the virtual side of it. So I guess I can give some of my experience with that. Despite it being on Zoom, I still felt like I got a lot out of the opportunity, and I made a lot of great connections with people. So I feel like I would encourage anyone, even though in Zoom might not be the best option as compared to in person, you can still have a very fulfilling internship, even if you are online. Along with that, for the internships that could help with whether you're going to plan to go to medical school or be in any type of medical field, I would definitely say that Lehigh especially has a lot of internships that are really great for students that are seeking that extra push to be in the field and have real life experiences. So as a freshman going into my sophomore year, I've already secured like basically 2 internships through 2 different groups. So I would definitely say that there are a lot of opportunities with that. So definitely do your own part in reaching out to people, but Lehigh will definitely, and the College of Health will provide a lot of resources that you can apply through. So definitely there will be a lot of opportunities with that.
I can jump in just on the specific pre-med sort of internships. They're looking for 2 types of internships, the clinical and the research-based. They want some sort of clinical experience. So shadowing physicians is always a big one, but anything you can do in the clinical realm is welcome. They also really like to see students participating in health research. Because academic medical centers do so much health research, they like to see students participating in that as well. So any kind of health research.
Excellent, thanks. So we're over time, but I think if everyone can stay, we could finish up the last couple of questions. It's wonderful that people are interested. And if you have to drop off, of course, feel free to do so. So we have a question about, it's again a pre-med. So if an international student joins your university as a pre-med, what are the chances for him or her to go to medical school?
So Lehigh's acceptance rates to medical school are about twice the national average. So we have a really, really good record of getting students into medical school, and that goes for domestic and international students. So if an international student comes to Lehigh, they're going to have the same opportunities. And lots of medical schools, certain medical schools are more friendly towards international students, and the pre-health advisors do help steer you towards those schools, but very good chances. And like I said, Lehigh's acceptance rates are about twice that of the average. So.
Wonderful. So final question, and this one probably is for Dr. Guzmano. Do you have any views on the MPH MBA dual degree and the sorts of job opportunities that will come out of that?
Sorry, my mute button didn't want to go off. Yes, well, so as I said before, I think there's not only a growing interest in this on the academic side by sort of, measured by the number of these programs that are growing, but I think this is clearly a reflection of demand, in part because the various industries are recognizing the value of this. And frankly, in the US and globally, if we think about the numbers that Dean Dolan shared in India and in the US in terms of the growth of the health sector, this is one of the fastest growing and largest opportunities for employment almost anywhere in the world. And so when people are thinking about what to do with their business degrees, if that's their original passion, they are often trying to combine that with substantive expertise in health, recognizing that many of the employment opportunities they'll face are in that sector. So I think it's a really exciting opportunity for growth, both for people running these programs, but also people looking for jobs.
And I'll just follow on that comment by remarking that Lehigh, just a little plug here, the College of Health is going to be launching with the College of Business, as Dr. Guzmano mentioned, actually 2 programs that combine business and health. One is we have something called a Flex MBA at Lehigh, and we'll be offering the healthcare management concentration in that course it'll start in summer 2023. So we're still ramping up to that. We have to get the I-17 clearance, et cetera. And then we also, as Dr. Guzmano mentioned, offering a joint MBA, MPH with the business school. And what I want to tell you about that is that ours, I believe, is the only one that you can complete in 18 months. So that's really fast for 2 degrees that are normally 2 years each. That's quite fast. So something to keep an eye out for. And so we'll end now, but I just want to thank everybody for taking the time to continue. And so many people stayed on, actually, even in overtime here. And we just hope to see you again in another event, or we can be available, of course, to answer any questions you have in general or about what we offer here at Lehigh. Any final words to share?
I'd like to thank you, first of all, everyone. So all the panelists, faculty members, and all the attendees, thank you so much for being with us today. And one more point on, the importance of public health I would like to highlight here is that, you will, if you go and see how many physicians, those who are MDs, are opting for public health now, because, it's something that cannot be ignored. And if this crisis has taught us something, I think this is one thing that we should definitely agree on, that public health infrastructure should be at least in parallel to the clinical care infrastructure. So with that thought, I think I would like to thank everyone again. And we will continue to interact, and please do leave your feedback. And if you are willing to know more about any particular topic or any particular area, do let us know, and we will convene a workshop on those topics also. Thank you. Thank you so much.
Thank you.